Hi friends, thanks so much for all your support and positive feedback that I got from doing that video on my mental health last week. So I thought I'd give it another go and let you know that a lot of the steps that I outlined that I was going to take have had a very positive effect. I'm completely not drinking any caffeine, except my psychiatrist did recommend green tea because it has a compound in it that can be very calming, and it has, way less caffeine than black tea or coffee. So I have matcha, and I am enjoying a cup of matcha every day very much with some oat milk chai creamer since I don't have dairy, and it's delicious and I haven't found it to be a problem. And otherwise, it's nice to be off caffeine. I think that definitely makes a difference. I have not been reading the news this week. I've seen allusions to the news on Facebook when I have been on Facebook that let me know that things aren't getting better out there. But for now, for my own mental health, I haven't dived down the rabbit hole of investigating those things, and that has paid off quite a lot. Last time I mentioned that my psychiatrist had recommended these Ollie's sleep gummies, and that have melatonin and also L-theanine in them, which is actually the same calming compound in green tea, and to have half an hour before I go to bed. I've only tried them once, but it was very nice and calming. I liked that a lot. But my anxiety has gone down so much this week that I haven't really needed them. I've been plenty tired going to bed. Haven't needed any help with that. And I'm doing quite well on some of the medication adjustments. So I'm relieved about that because medication adjustments can be very challenging and can often result in flare-ups of issues. If you are struggling with a mental health issue and you think you might need medication, it's good to talk about that with a doctor. Definitely good to pursue counseling first. But if you're going to go to the medication route, find a good psychiatrist. Oh my goodness, I didn't know the difference really 6 years ago when I started on some antidepressants, and they had really, really bad side effects for me that made me far worse, which ultimately I think is what part of the reason I ended up hospitalized, because they had very negative effects, and my doctor didn't really recognize that. My primary care physician, she didn't really recognize what was going on, and it wasn't until I got into the hospital that they're much more knowledgeable there about medications and effects, and they were able to help start setting me right again and get back to my right mind. Hallelujah. I'm ever thankful for them. Psychiatric hospitals don't necessarily always deserve all of the negative connotations that come with them. I was really, really thankful for everything they did during my stay there. And thank you, Holly Hill Hospital in Raleigh. You're totally awesome. Anyway, I have a good psychiatrist now, and I have not had any of the same kind of issues as before. And if you don't like your psychiatrist and they just feel like you're checking in and checking out and not really paying attention, then you should get a new one. Anyway, I'm very blessed that I have a really good one. So a lot of questions came up that people wrote to me about kind of OCD and what it is, and what my experiences are with it. So OCD, it's like if you think of anxiety as a tree, OCD is one of the branches that it can take. Kind of the root is, anxiety disorders and issues, but it's one of the branches, and the branches can have lots of branches, so it can look a lot of different ways. But essentially, it's like, you have your amygdala that's sending out distress signals of some kind, whether they're legitimate or not. I'm sure, if you were a person without much anxiety or OCD watching this, I'm sure that you too, sometimes have kind of just random crazy thoughts that pop into your mind sometimes, but they're just so silly that you're able to dismiss them like, oh, that's weird, must have eaten something funny last night. But a person with OCD, it's like those kind of thoughts get stuck. There's a specific part of the brain that is supposed to kind of process these thoughts, and if you don't have OCD, then you just process it. You said, oh, that thought from my brain, that's that's bizarre junk. Okay, bye. And you don't see it again. A person with OCD sees it again and again and again. It refuses to go push on through the processing phase. So it's like you're stuck in this cycle. And, the more you think about it, the more you might wonder if it's true. And you're looking for some possible way to get rid of it. And in the strangeness of the brain, comes up with all kinds of ways to try to get rid of the discomfort that comes from these anxiety-producing thoughts. So they call those thoughts obsessions, and then what you try to do to get rid of them are the compulsions. So a lot of people, when they hear OCD, immediately think of the obsessive hand washing, and that is a problem for a lot of people. It's not really one of my issues, but it's good to illustrate. So essentially, a person that doesn't have the hand washing issue, when you wash your hands, you have a good sense of when it's done. You washed your hands you scrub for 20 seconds, maybe you sang a song, and then you feel like you're done. You got all the germs off, you dry your hands, you walk away, and you don't think about it anymore. But the person with OCD and this specific problem will feel this just feeling like there's probably germs that I missed on my hands, and they could be really deadly germs. And I might, spread some horrible disease to my family kind of germs. There could be all kinds of reasons. Anyway, it's like that part in their brain that says hand washing done, accomplished, is not clicking. So they just feel like they are not done washing their hands well enough. And so it's the same thing. This also manifests in different ways. Like, rationally that you locked the back door, before you went to bed. But you lie in bed wondering if you really locked the door. And so you get up and go and look to see if it's locked again. And it's locked, so you go back to bed. And then you're like, but is it really locked? Maybe I made a mistake. Maybe it's not really locked. So you go back and you look again. I have had that problem occasionally. It's like one part of your brain knows that this is nonsense, this is ridiculous, but the other part of your brain is saying, no, there's a problem here. This could really be something. Otherwise, for example, I really struggled with when my babies were little. I was terrified of them dying in their sleep, and I would go in and check to make sure that their breasts were rising and falling, that they're still breathing, and then I'd leave, and then I'd feel like, well, maybe something happened in the last 5 seconds. I better go check again. And I could get in this cycle of just checking, and it's like I'd feel that the other part of my side is like, no, just go to bed, you're exhausted. But it's like, no, I gotta check. So that became a compulsion. I have this obsessive thought saying, well, maybe they're dead now. And I better check again to make myself feel better. And, you could go with that all night. It's just, it can drive you totally insane. So oftentimes it will take, a legitimate fear. Some infants do die in their sleep. It's, it's something to take seriously, but, most people know how to put a lid on it and say, okay, I've checked, they're okay, and then go to bed, without checking again and again and again. So other ways that we OCD sufferers face challenges is, is mundane choices we can end up taking very, very seriously. Because let's say, this is a big one for me that I have struggled with a lot in the past is, worrying about organic foods and feeding my children, wanting to feed them organic foods and getting really worried if I'm feeding them non-organic foods. So I used to have just a horrible time grocery shopping, standing and reading labels and, trying to find the best breakfast cereal. If there weren't many organic options that I knew my kids would eat, I'd be like, reading the Cheerios box and reading the Rice Chex box and reading all the other labels and getting just so agitated about, well, this one's non-GMO, but it has these bad things in it, but this one is GMO, but I know they'll eat it, and I could get completely paralyzed in the grocery store because of this overwhelming fear of the bad things that could happen if I bought food that might have pesticide residues in it. So yes, pesticides in food I do rationally think are a real problem, but as someone with OCD, I can get totally paralyzed in the grocery store. I remember one time, I think, trying to buy lotion in Target and just starting to cry in the aisle because I could not make a decision between the pros and cons of these different lotions. And OCD tells you that this is a life and death decision. And, you know, and you just get so worked up and anxious, and you're trying to like choose the right lotion already so you can just get that resolved feeling that this lotion is okay and I can move on with my life. But there you are, you're trapped crying in Target because you can't find one that makes you feel that way. So it's a lot about you are doing these kind of, they call them rituals or compulsions, to try to get to your brain to the point where you feel okay. You get this positive feeling somewhere in your chest or your abdomen that you've made the right choice, but OCD doesn't usually let you make that right choice. A whole nother category of OCD is just the thoughts that come into your brain, maybe not about doing something specifically, but one of my great struggles that has been hugely helped by medication was, you know, medical anxiety. So if you're watching this and you knew me as the pre-breakdown Kirsty, especially my friends at the Garden in Baltimore, at the Garden Church, going to Bible studies, I usually always had prayer requests about my health. Now, I have had some legitimately pretty scary health scares that all turned out okay. But my medical anxiety had a lot to do, and will still have to do sometimes, with, you know, worrying about if some twinge or pain or something is cancer, and I'm going to find out that I have stage 4 cancer. And I'm going to be dead in 3 months, and I'm imagining my funeral and, you know, everybody crying and my children without a mother. And that would put me in a huge state of anxiety. So I was constantly worrying about if this or that is indicative of a majorly serious problem. And living in constant fear of my life, that was horrible. I mean, the anxiety was affecting my body so much so that, I mean, anxiety can have a tremendous amount of side effects in your body. So the anxiety was causing all of these things to happen in my body that then I panicked and worried about because, you know, they could be indicative of a horrible condition. So I used to go to the doctor a lot. I had lots of tests. I'm really, really thankful for my doctor that I had in Baltimore. I don't think that she's still practicing at that practice, but anywhere, if you might be seeing this, Dr. Conkle of Towson Medical Associates, you were so patient and amazing with me. I wish, you know, she could know that I'm doing so much better now. I just don't go to the doctor very often because I'm not worried anymore about everything. I remember I would just be at the playground with my kids and trying to enjoy having fun with them. But I would have this horrible feeling that kept coming back again and again that, like, I have that feeling is cancer and you are going to die. You know, it's just repetitive. And I would feel like, can't somebody please shut these horrible voices off in my mind? Like, it caused me so much anxiety. I couldn't focus on my children. I was not fully present with them because I was so worried and afraid. And these thoughts were just going over and over and over. Other categories of thoughts, you know, it's like you might have a picture of that pops into your head of you, you know, killing your pet with a knife, a kitchen knife. A lot of people that I know struggle with this. This fear that you're going to do something to hurt yourself or hurt a family member, hurt an animal, hurt your baby. It becomes this paralyzing, terrible fear. It's a thought that gets trapped in and you're afraid of it. It produces a great deal of anxiety. So a lot of people then will deal with that by, say, hiding all the kitchen knives and trying to cook without any knives. Now, the truth is these thoughts have no bearing in reality. They do not reflect some deep thing that secretly you are a murderer or, you know, a psychopath. But it was somebody with OCD can get consumed by this thought. They think that I can say, I would think that because I'm having this thought, it says something terrible about me and I need to take action to make sure I don't do this thing. So for me, what the ultimate thing that sent me to check myself into the psychiatric hospital in 2014 was these suicidal thoughts that were not actually, I didn't want to. I did not want to kill myself. That presented itself as a horrible fear. I just had this obsessive thought, well, maybe you will. Maybe you won't be able to handle this, and maybe you will. And I would respond, and here's the compulsion, it doesn't have to be something you do. My compulsion would be like to tell myself over and over again, I would never do something like that. I would never, ever do that. Oh, but maybe you will. You go over this cycle again and again, and that to me was so horribly personally indicative. Like, it was just so terrifying to me that I couldn't sleep. That particular thought was just, that was the tipping point for me, that I was having those kind of thoughts. And I think one of the reasons why they accepted me into the hospital was because I was describing these horrible graphic images that were happening in my head. And I think, the intake person was they were alarmed by that and maybe thought I really was suicidal. But now I know I wasn't. And, that thought, if it comes back, occasionally it does, it still scares the heck out of me, because that's not something I want to do. I know what suicide is. I've experienced it happening to people I know and love. It's horrible. It's tragic. But I understand now that that's a whole different category of a problem, that what I was experiencing was not actual real suicidal thoughts. It was just the fear of that I might do it someday. So as I said, just people might be terrified that they're going to hurt one of their children. They might have just graphic, really disturbing sexual images involving other people or children, and that will cut people to the core. Oh yeah, because the thing is these thoughts, they're like, really, they're your deepest fears. The OCD thoughts tend to be pictures of things that you would never do, and they're completely against your most deep innermost values. So really, the person that is so worried about stabbing their dog with a kitchen knife, that's the last thing in the world, truly, that they would ever do. They don't want to do it, and they're not going to do it. But it's that thought in their mind, and the more that you pay attention to it, the worse it gets. So there's all kinds of excellent therapies for these things, but for a lot of times it's very, very hard because, as I felt so deeply ashamed that I could be having these disgusting, graphic thoughts. And they can be, because I'm a Christian, I love Jesus very much, and so what a better way to torture me as OCD than to show me like awful, disturbing images about Jesus doing things he would never do, or, sexual images about him, things like that. It's just, that's horrible. So, as I said, there's a lot of good therapies about this, but oftentimes it's very hard for people to kind of come out of the shadows because of the shame that they're experiencing about the fact that they had these horrible thoughts that terrify and disgust them. It would be, very hard. It's very hard for people that are struggling with this to understand that they fear that, if they confess this to anybody, that they're having these kind of thoughts, that they will think they're crazy, they will lock them up, awful things will happen, and there's some possibilities, I suppose, that could happen, with people that don't truly really understand what's going on. So, going back to my fear of suicide, if I didn't have a psychiatrist at that point, and I remember that morning, I dragged myself to my family doctor, and I was just on my knees crying and crying in the exam room, and she's talking to me, and she hears what I was saying, and she sees this girl is suicidal, and she's trying to tell me all these things why I should never do it, and I'm like, I know all those things, I don't want to. She didn't understand what was going on in my mind, that I wasn't actually suicidal. I was just having severe untreated OCD. And I'm just really blessed that I did go to the hospital, and that connected with doctors there that really understood what was going on with me. That was such a relief. I mean, that experience, and especially with the 2-week outpatient group therapy that I had after that, and then seeing a really good counselor, it was just like such freedom to understand these things aren't saying anything about me. These horrible thoughts are not reflective of who I actually truly am. And I was able to begin to separate myself from those thoughts and understand that's just OCD. It's still really hard sometimes, but that's, I feel like, the first amazing key in therapy is when you have that realization that these things are OCD. They're not me. They're not who I really am. So I could talk on and on, but I'm more than happy to do more videos if you have very specific questions. There's a lot of things I haven't covered here, but I've already been going for 20 minutes, so anyway, hope this was helpful for you.